HIV is diagnosed through a blood test, so some people go in specifically for STI testing, some people go in for other routine blood work or prenatal testing and find out that way. Everybody can test positive. Everybody's at risk if you've had unprotected sex or other risky behaviors. So, no. Treatment for HIV can be pretty complicated, so maybe not everyone understands the process fully. No, that doesn't surprise me at all. Probably a lot of people are anxious to get tested in the first place. There's a lot of stigma around HIV, stigma around testing, discomfort with the medical system. So no, I'm not surprised. I think people's perception has changed a lot. I think the face of HIV has changed, so people are realizing that it's not so much a gay people disease and that anyone can get it. But that said, there's still a long way to go. Get tested. Early treatment equals better outcomes. I hope so. I think testing for other STIs is becoming more normalized, so hopefully. It would have to start with people understanding what HIV is all about and understanding the risks. I think there's a lot of misconception around how you can get HIV, so a lot of people think that they're not at risk when they may be. So if people understand their risks, then maybe they'd be more inclined to get tested. So using condoms every time you have sex helps reduce your risk of HIV and other STIs and reduces your risk of pregnancy at the same time. I think growing up, when HIV was first kind of coming out, and definitely it was one of those far removed kind of illnesses that wouldn't conceivably come into my life. So as times have changed and my knowledge has increased, I've realized that not only does HIV affect everyone around me, or many people around me, but everyone is at risk. Know your risks and dispel the myths. Myths around who could be affected, myths around how you can get the illness, risks around outcomes. Yeah, there's myths around everything about HIV. So a lot of people think you can get HIV by kissing. You can't. A lot of people think you probably won't get HIV by having unprotected sex with someone who seems like they couldn't possibly have HIV, but you can. Maybe people think that you won't get HIV by sharing a needle just one time, but it's possible. I think, in particular, when people don't know that they're positive, they could be spreading the disease without even knowing that they're doing so. So I think there's quite a bit of risk there for our communities.